Good morning. My name is Erin Murders, and today I'm presenting on preventing cervical cancer, the role of HPV vaccination, screening, and public health policy. Cervical cancer remains a pressing public health concern, especially for underserved populations. This presentation examines how prevention strategies and policy can reduce disease burden and promote equity. Globally, cervical cancer is a leading cause of cancer death among women, especially in low resource settings. In the United States, we see about 11,500 new cases and 4,000 deaths annually. This disease is almost entirely preventable, primarily caused by persistent infection with high risk strains of human papillomavirus, or HPV. If undetected, these infections can progress to invasive cancer. Despite available vaccines and screening methods, major gaps in prevention and early detection remain, particularly in marginalized communities. From a public health perspective, the burden of cervical cancer reflects deeper systemic issues. Risk factors such as early sexual activity, multiple partners, smoking, and limited healthcare access intersect with broader social determinants like income, education, and insurance status. HPV, while transmitted sexually, behaves like an infectious agent in its ability to create long-term harm when public health infrastructure fails. What's especially troubling is the incidence and mortality rates are disproportionately higher among marginalized groups, including women of color and those living in rural or low-income areas. These inequities demand not just awareness, but action. Effective screening is essential for early detection and prevention. We primarily use two tests: the Pap test, which detects abnormal or cancerous cervical cells, and the HPV DNA test, which identifies high-risk HPV strains. The Pap test has a sensitivity ranging from 55 to 80%, while the HPV DNA testing offers over 90% sensitivity. But numbers don't tell the whole story. Disparities in access to these services, combined with poor follow-up and limited public awareness, mean many high-risk individuals are not getting screened at all. And without regular screening, cervical cancer often isn't caught until it's too late. Prevention is where public policy becomes critical. HPV vaccination is safe and effective, but its access is uneven. Title X, a federally funded program, provides essential reproductive health services, including cervical cancer screening, vaccines, and health education, to millions of low-income and uninsured individuals. These services are lifelines, but they're vulnerable to budget cuts and political shifts. Reduction in Title X funding could disproportionately affect those already at high risk of cervical cancer. Sustaining and expanding programs like Title X is essential not just for prevention, but for equity. So where do we go from here? First, we must expand HPV vaccination coverage through school and community-based programs, especially in underserved areas. Second, we need to ensure that routine cervical cancer screening is accessible, affordable, and culturally appropriate. That means increasing outreach, reducing logistical barriers like transportation, and training providers to deliver care in a respectful and inclusive manner. Finally, we must advocate for strong public policies that prioritize prevention care. This includes securing funding for Title X and other safety net services that are proven to reduce disparities in reproductive health outcomes. Addressing cervical cancer isn't just about medicine, it's about justice. The tools to eliminate this disease already exist, but they are not reaching everyone. If we want to achieve true health equity, we must act on multiple levels: clinical, community, and policy. By strengthening vaccination programs, ensuring widespread and regular screening, and protecting public health infrastructure, we can significantly reduce the burden of cervical cancer. And in doing so, we affirm the right of every person, regardless of race, income, or geography, to a healthy future. Thank you for your time, and I welcome any questions.